Hi, everyone. My name is Alexis Salmon, and I'm a current occupational therapy doctoral student at Roberts Wesleyan University. Thank you so much for taking the time to watch this video. Today, I'll be walking you through early child development from an OT perspective, what's typical, what to look for, and how you can support your child in everyday life. I'm hoping to build confidence and not overwhelm anyone. The information on these slides does not need to be memorized as it will be available to you for as long as you need it. I would just like for every person watching to keep in mind that it is important if you do have a pen and a piece of paper to have it right next to you while you are watching this video, just in case you would like to jot down any signs and symptoms or anything that I talk about that you do feel needs to be addressed with your child. Child development happens across multiple areas, not just physical skills, but also social, emotional, communication, and self care skills. You might hear the term developmental milestones. These are just skills that most children develop over time. But something really important to remember is that milestones are guides, not strict rules. Every child develops at their own pace, and some variation is completely normal. Just to give a quick example, when a child learns to sit, they're not just using motor skills, they're also interacting, exploring, and learning. Motor skills are what allow children to move their bodies and interact with the world around them. These skills are what help kids do everyday things like feeding themselves, getting dressed, brushing their teeth, and playing with others. As children grow, both fine motor and gross motor skills develop, and these are really important for building independence. Even something like brushing teeth requires coordination, strength, and planning, which is why motor development is such a big focus in occupational therapy. One of the reasons why we talk about development is to recognize when someone might need extra support. Early identification is really important because it allows children to get help sooner, which can make a big difference in improving their skills. One thing we especially pay attention to is regression, meaning a child loses a skill that they previously had. That is something that should always be followed up on. We're not looking to label children at all, we're just looking to support them early if possible. Gross motor skills involve big movements like sitting, walking, running, and jumping. These skills support things like balance, coordination, and posture, but they also impact other areas like fine motor skills and even participation in play and social activities. Gross motor skills are basically the foundation for everything else. For example, if a child can't sit upright, it's harder to use their hands or to even focus. Motor development follows predictable patterns. Children typically develop from head to toe, so they gain head control before walking. They also develop from the center of their body outward, so core strength comes before hand control. And each skill builds on the next, like rolling, then sitting, then crawling, then walking. Variability is very normal across children. In simpler terms, head, body, then legs. Core first, then arms, then legs. You can't build a house without a strong foundation, right? I am not expecting you guys to remember everything on these slides, but the most important thing to highlight is that over time, independence should be increasing in children. In the early months, we're looking at things like head control, rolling, and beginning to sit with support. Tummy time is especially important here. It helps build strength in the neck, shoulders, and core, which sets the foundation for future movements. As babies grow, they begin sitting independently, crawling, pulling to stand, and eventually starting to walk. During this time, we see a big increase in mobility and independence. In toddlerhood, children start walking on their own, running, climbing, and exploring many different things. This stage is really about independence and interacting with their environment. As children get older, their skills become more refined. They're jumping, climbing, riding tricycles, and improving coordination and balance, which are all important for play and school readiness. While physical therapy is the primary service provider that addresses gross motor development, OTs also help assess development and support children through play based activities. OTs don't just exercise with kids, we use play as well. OTs also work closely with parents to provide strategies that can be used at home, like tummy time, floor play, and movement based activities. Core strength and posture matter because it supports sitting at the table, playing with toys, and using hands effectively. A strong core helps children stay upright and stable, which directly supports fine motor skills and attention during tasks. Development is influenced by many factors like environment, opportunities to move, and practice. The key takeaway here is that skills develop through everyday routines and not just during therapy time. These are some signs that may indicate a child needs additional support, signs to pay attention to but not to panic about. Things like not sitting, not walking, frequent falling, or avoiding movement are worth paying attention to. And again, loss of skills at any age is something that should be addressed right away. I will give you a brief moment to jot down any red flags you may have noticed within your child so that they can be addressed in the near future. Fine motor skills involve the small muscles in hands and fingers. These are important for tasks like feeding, dressing, writing, and playing, and overall functioning independently. Early on, we see babies moving from reflexive grasping to more intentional reaching and grabbing. They begin transferring objects and eventually develop a pincer grasp using their thumb and their index finger. A pincer grasp should look something like this, whether they're grabbing a piece of cereal or any types of food that they're interested in. It involves their thumb and their index finger. And here's just another brief example. But with stacking blocks, not only are we looking at how they grasp the cube, but are they able to stack using eye hand coordination, which is the ability to use your eyes and your hands at the same time. This is a visual motor skill. By one, children should be able to pick up items at the tips of their fingers and not the pads. Eye hand coordination continues to be an important visual motor skill as children age. As they grow, they begin feeding themselves, scribbling, using utensils, and manipulating objects like buttons or toys. Scribbling is a visual motor skill, but it also is looking at the grasp and looking at how children execute. Same with turning the pages of a book. In preschool years, fine motor skills become more refined. Things like using scissors, drawing shapes, and dressing independently all start to occur around ages 3 to 5 years old. OTs support fine motor development through play based and task specific activities, helping children participate more independently in daily life. Tasks are broken into manageable steps, and strength is built through play and practicing real tasks. Interventions are strategies or activities that can be used to help a child learn or improve their skills. So, here on this slide, I have provided a list of different intervention strategies that specifically are tailored to fine motor development. Here are some more signs to pay attention to but not to panic about. If a child isn't reaching or grasping, that is something to look into. I will give a brief moment again to jot down anything that you feel is necessary to address in the near future. As a caregiver, it is important to understand social emotional development. This area focuses on how children form relationships, express their emotions, and interact with others. It starts at birth and develops throughout everyday interactions. Young children have big feelings and they're still learning how to manage them. What might look like bad behavior is often actually their way of communicating. They aren't misbehaving, they're just still learning. Across ages, children move from basic interactions like smiling and responding to caregivers to playing alongside others and eventually engaging in cooperative play and friendships. Babies are mostly looking for connection from their caregivers. Toddlers develop very big emotions. There is a difference between temper tantrums and meltdowns. So, a temper tantrum occurs when a child is trying to get something that they want or avoid something that they don't want. A temper tantrum is usually short lived and will stop if the child can get what they want or gets distracted by something else. This usually lasts from anywhere from 5 to 10 minutes. A meltdown happens when a child is completely overwhelmed and cannot calm themselves down. This can go on for 15 minutes or longer, and children do not stop quickly, even if you try to distract them or give in to what they want. In preschool, children start to develop friendships, which allows them to engage in social participation. Social participation is very important as an educational skill. Here are some more signs to pay attention to but not panic about. Things like limited eye contact, not responding to their name, or difficulty regulating their emotions. I will give another brief moment to jot down anything you feel is necessary to address in the near future, as these can be important signs that a child may benefit from support. One role of occupational therapy is to screen and assess your child. Depending on the setting that you go to, assessments vary from one setting to another, but the overall goal is to understand your child's needs and determine what supports will help them the most. Emotional regulation is how a child handles their feelings, like calming down when upset or not getting too overwhelmed. Most importantly, being able to manage and respond to feelings in a safe and appropriate way. Children aren't born knowing how to regulate their emotions, they learn through adults. Behaviors often happen with children because they lack skills, not discipline. According to 0 to 3, toddlers often act out because they cannot yet express themselves or manage impulses. Children learn to regulate by first being regulated by a calm adult. This is called co regulation. Co regulation is another way of saying children borrow your calm. Adults help children calm down by staying calm themselves, getting on a child's level, and labeling their feelings. It is important to connect first, then teach behavior, rather than using punishment. Validating feelings while setting limits helps children learn appropriate behavior. Positive supportive discipline is more effective than punishment in teaching skills. It is important for parents and caregivers to know that you cannot teach a child when a child is overwhelmed. Consistency helps children feel safe and understand boundaries, reducing challenging behaviors. According to 0 to 3, routines create a sense of security and prevent many behavior challenges before they even start. Parents can prevent behaviors by watching for triggers like hunger, fatigue, or transitions. Try to plan ahead or give choices to prevent behaviors. Giving a child multiple choices to pick from also gives them a sense of feeling independent. If you ever notice loss of skills, extreme sensitivities, or concerns across multiple areas that have been discussed, it is important to seek support. Here is a provided list of things that you can do if you are feeling concerned as a caregiver. Before we go further, I just want to mention that communication and language development is a really big and important area. As an occupational therapy student, this isn't my primary specialty. That's typically the role of a speech language pathologist. But as OTs, we work very closely with speech therapists because communication is such a big part of a child's daily life, routines, and play. So while I'm not going to do a deep dive here, I do want to give you guys some helpful basics and strategies that you can start using right away if needed. According to the CDC and American Speech Language Hearing Association, Communication begins in infancy through sounds, gestures, and interactions, not just talking. These early skills are critical for later development. Communication actually starts with eye contact and play. These skills build foundation for language, learning, and relationships. Again, all children develop at different rates, but these help identify when support may be needed. Please take a brief moment to jot down anything that stands out to you or anything you may want to address in the near future. Caregivers, believe it or not, you are your child's best teacher. 0 to 3 emphasizes that everyday interactions like talking, reading, and playing are the most powerful tools for developing language. Caregivers can support language through everyday interactions, talking, playing, reading, and repeating words. Simple things like labeling objects or expanding what your child says can make a very big difference. Repetition strengthens understanding and memory. Hearing words repeatedly in context helps children learn faster. Repetition during daily routines help children build strength, coordination, and independence over time. Children learn best through play. Play creates natural opportunities for communication and engagement. Talking, reading, and playing support early language and brain development. Children learn best through play. Making tasks fun increases engagement and motivation. Here are some moments to consider when to seek help, whether that is with a speech language pathologist or just receiving early intervention services. Early intervention uses play and coaching to help children build communication skills, and parents are key partners in this process. As a caregiver, it is important to understand attention within a child. Attention is something that develops over time if movement actually helps children focus. Short, engaging activities and simple directions can really support success. The American Occupational Therapy Association, also known as AOTA, emphasizes that movement is essential for attention and participation. Kids need to move to learn. It's not a distraction, it's actually support. When children are overwhelmed, their attention decreases. Simple tasks and environments help them stay engaged and stay successful. What is early intervention? Early intervention, also known as EI, is a system of services that supports young children from ages 0 to 3 with developmental delays and their families. It is funded through the IDEA Part C and available in every state. Parents do not need to wait in order to seek EI services because parents can self refer if they have concerns, and EI is typically free or a low cost. Here is how to get an evaluation for your child. The CDC emphasizes act early. If you have concerns, do not wait. Families can request an evaluation directly, and eligibility is based on the developmental assessment. Caregivers, you guys are your child's best advocate, I promise. You know them best, and your voice is a critical part of their care team. Early intervention is family centered. Services are often provided in natural environments like home, and caregivers are active participants in helping children learn skills. Before we proceed, it will mean the world to me and help me out greatly to understand if this educational video helped you out or not. If you could take a brief moment to fill out this short survey, I would greatly appreciate it. I am also providing the link in the comments if that makes the survey easier to access. Thank you all for your time, and I hope that this has been of help. On these next three slides, I have provided all of the references that I have used throughout this entire video. If you would like to visit any of these references, they are available to you. Again, thank you all for your time, and I hope that you enjoy watching.